Hello and good morning, everyone. It's now 9 a.m. and we're going to kick off our meeting. I would like to thank everyone for being here today and wish everyone a happy Friday. I'm pleased to have with us today representation from Wellstar Hospital, Cobb Douglas Public Health, and from the county. These updates provide opportunity for us to learn about the impact that COVID is having in our community, and it also helps to inform the county's response. Today's meeting is unique in that it is a public meeting, and we've changed to this format in order to allow all the commissioners and the public to receive this information real time, and that helps to clarify any misinformation or clarify good information immediately and get us all on the same page. Just a reminder that the county is still under an emergency order with respect to the pandemic. That order is slated to expire on January 22nd, unless it is renewed. It will be renewed if we do not see any market decrease in our COVID transmission rate. And so I just want to inform people that that likely is going to happen. In response to the emergency order, our county manager has placed a mask requirement for our facilities. And so that may likely continue if this emergency order is renewed. I certainly want to thank some people who are on this call who I have seen probably over the last 12 hours or so, but we had a community virtual town hall of people update people with respect to the pandemic, and we had representation from Wellstar and Cobb Douglas Public Health. I can't see everyone on my screen, but I just want to give a shout out to Dr. Memark, Lisa Crossman with Cobb Douglas Public Health, and also to Dr. Brandstetter and Stephen Vault with Wellstar, and fielding questions from the public with respect to any of their concerns with respect to the pandemic. It was certainly well received, but certainly, as was shared during that town hall, there are persons in our community who are extremely frustrated about the circumstance and who've questioned the science behind the pandemic, which is why, again, meetings like this are very important to ensure that we are getting accurate data out there in the community. So with that, I'd like to turn things over to Dr. Chapman with Wellstar.
Good morning. Can everyone hear me?
I can hear you. I can hear you faintly, but I can hear you.
I'm Mary Chapman. I'm representing Wellstar. And again, we're always very appreciative of the collaboration. Like last week, Chairwoman Cupid, we have a little bit of schedule challenge. And so we're going to, I'll move my comments, if it's okay, to after John Keevan. We typically will give a broad update and then pivot to having specific conversations about our two hospitals within Cobb County. Interestingly enough, he needs to transition off at 9:15 to talk about inclement weather preparation and also COVID operations planning for the system. So if okay, I'll transition to him and he'll talk specifically about Kennestone and Cobb, and then we'll pivot back to me and I'll give some system numbers and updates. John?
Wonderful.
Thank you, Mary. Certainly appreciate the intro and apologize to everyone for the timing this morning. But glad to be here with you today. I'm here to share an update and certainly appreciate the partnership we have with our commissioners. Thank you all for putting this together. It's great to get on and share information and all be on the same page. And all the support we receive from community members across Wellstar can't be said enough how much we appreciate that. We continue to work as a system and a team to provide high quality care. Both Kennestone and Cobb continue to see an increase in COVID patient volumes, and Mary will talk a little bit about the system numbers here shortly, but Kennestone has increased almost 250 cases. Similarly, Cobb has remained at 130 plus cases over the last few weeks. Do want to continue to emphasize, and I'm sure there'll be more discussion around this today, that the vast majority of these cases continue to be among the unvaccinated. And the volumes in our emergency rooms continue to remain high. We are working to mitigate that as much as possible, move people through the ER safely and as timely as possible. But we continue to ask the public to consider not using the emergency room for a primary site for COVID testing. We certainly, if you need the emergency room, we are here to help. But if you are coming just to get screened for COVID, we'd ask that you seek that screening process elsewhere. We have seen some stabilization in our team members having to quarantine, so that number has gotten a little bit better for us, thankfully. We continue to follow the CDC protocols for returning those team members to work, to do that as safely and quickly as possible. I do want to highlight that both Kennesaw and Cobb, we do remain at a restricted visitation status. Again, this to ensure the safety of our patients and team members. This status means that visitors are currently prohibited except for certain circumstances, right? Like end of life, it's any other safety considerations, cognitive situations. But this restriction, again, is based on the prevalence of the virus in the community, not necessarily how many patients, COVID patients we have in the building. And we do this to limit the exposure for our staff and our patients in the building. It's always a difficult decision to make. We do not take this lightly, but our team stands ready to partner with families to provide updates more frequently and ease this burden as much as possible. And as soon as safe to do so, we certainly will ease those restrictions and get family members back in the building. From a PPE and supply standpoint, we continue to maintain a very healthy supply of masks, gloves, gowns, all the things that our team needs to take care of that. Partnering with our supply chain and biomed teams, they do a great job keeping us stocked. We also are very thankful to welcome 12 National Guard servicemen and women back to Kennesaw Hospital this week to help with this latest surge. And we continue to partner with the state for resources. They're always helpful in getting us additional resources and help, whether it be agency nursing or the National Guard. We're very appreciated. And really at Wellstar, we're prepared. Our team members continue to relentlessly pursue excellence, which is one of our values each and every day. We are also here to serve with compassion, which is one of our action-oriented values, quality and partnership. And just want to thank you again to everyone on this call for working with us and helping us care for our community. We couldn't do it without this partnership, and happy to answer any questions and turn it back over to Mary. But that's a bit of what's going on at Cobb and Kennesaw hospitals.
Thank you, John. And I know you're off to the next operation. I'll talk a little bit about specifically at Wellstar. I'll mention one other staffing nuance that's in John's space, and that is that every time we have a surge, we also have team members who are willing to deploy or redeploy, leave their current day jobs, operations, and move closer to the front lines to help us with patient care. And you see that oftentimes on TV, where the teams are doing different jobs than they had before. We call that redeployment, and we have close to 300 that are eligible, and we recently currently have about 200 team members within Wellstar who are already doing that. And so we just appreciate them. And if you hear that, that is accurate, and it's a normal part of our surge planning. Speaking of surge planning, I wanted to go specifically to some numbers for our system. And I know that when Dr. Memark talks, she'll talk about some broader numbers in the U.S. as well as the DPH numbers. And then Dr. Brandstetter will talk more specifically about some of the updates in the treatments and some of the questions that I know that you all may have that you have heard in the most recent. But from a capacity perspective, as of yesterday, Wellstar had over 800 COVID patients admitted to our hospitals. That is the highest. That puts this surge number 5, as our highest numbers of incident within our hospitals since the pandemic. That is, and out of those, 71% of those patients are unvaccinated. We can't say enough about please asking all of our community to help us by encouraging our community members to be vaccinated, including getting their booster shot. And then also still following the 3 W's is very, very important. We had 125 COVID patients in our ICUs across the system. And then also we had 63 of those patients on ventilators, and 81% of the patients who are on ventilators are unvaccinated. There's a 2-point validation process for, so we use data, and we're tracking this data every day, and we're trying to run samples to try to predict, again, the prevalence, but we just feel that we just can't say enough about, again, just helping us to be able to manage on a day-to-day basis these numbers that we see. Our team members, as John said, continue to be 100% committed in caring for these patients. And we know that many of them perhaps are even our family members. And I just want to make a plea for the team to say this pandemic, Surge 5, is a little bit unique in that it could be prevented in terms of the high numbers. So if you're thinking, how can I help? I can't reiterate enough the notion of asking our community to join in with us and and help encourage people to get vaccinated. So we remain ready for increased numbers, but we're crossing our fingers and toes and really hoping that we will see a peak very soon, and we will begin to see those numbers going down. The not so good news is that currently is not the case, but we are staying focused and really, really, truly appreciate the collaboration. With that, I am going to turn it over to Dr. Memark to ask her to make some comments.
Great. Thank you so much, Mary, and thank you to the county for having us today. I'm going to give you a bit of an update on our numbers in the county. I'm a little dismayed to hear that our hospitals are not doing better quite yet, because I know it's just been very, very busy for you all. But I hope like you, hope it will come down soon. What we are seeing in our county right now is, over the last few days, we've seen a very slight decline in case numbers over the 2-week rate. Now, it's a slight decline, but it's really still extraordinarily high. We last night were at 2,536 cases per 100,000, and that came down from yesterday from 2,626. So yes, slightly lower, but really in the very high range. Our positivity rate came down slightly as well, from 32.8% to 31.7%. So still almost a third of those PCR tests are coming back positive right now. And for those of you that wonder about some of these counts, yes, it's probably an undercount, because the antigens and home tests, all those are not all included in this, so it is probably higher. We continue to see deaths that are coming in. There's been a slight uptick, not what we had seen previously with Delta and the first surge, but we still have lost 1,491 Cobb citizens to COVID-19. This puts us, continues to have us in the high transmission rate. Remember, over 100,000 for 2 weeks is considered high transmission. And so we're way past high transmission. And this is very, very substantial community transmission. So it is circulating very easily in the community. And that's due to Omicron. And we've talked about this before. I know, and everybody knows that, symptoms of Omicron are thought to be milder than Delta. But the high transmissibility of this variant makes it so that many, many more people can get infected. And so when you have that many, you're going to see what we're seeing in our hospitals right now, because it's just a matter of numbers. So having a large number of people infected means that even if it's a small percentage that are hospitalized, that will also be a large number. In Georgia, what they saw this week is over 24,000 cases in a day, and that's more than double the highest number of cases that we've seen yet in the pandemic. So that gives you an indication of the transmissibility of Omicron. We did see some declines over the last few weeks in school-age children, but this week has seen an increase in that as well, and probably due to the return of children to school. I'm going to reiterate what Dr. Chapman said about vaccines. You've already heard that most of the people that are in the hospital and almost all of the people that have died from COVID are unvaccinated. Studies are showing that if you have your 2-dose series or your 1 dose of your Johnson & Johnson against Omicron, that puts you at about 35% effectiveness. Still protects against death and hospitalizations, but if you get the booster shot, you're at 75%. And that's very important. What we're seeing right now for Cobb is a 64% for the first dose, 59% for fully vaccinated, and only 22% or less than a quarter of our citizens have received a booster shot. Remember, everyone 12 and over can get a booster shot regardless of your medical conditions. So please, you should get that. And that's over 5 months from your series completion. So 5 years and older they're eligible for a vaccine, for a COVID-19 vaccine, and 12 and up are eligible for boosters. I want to talk just quickly about tests. And so Lisa Crossman, my deputy, will talk a little bit more about testing sites and what we're doing in the health equity space. But there's a lot of talk about rapid tests, and many people will be eligible to get rapid tests soon from the federal government and from other sources. So I just wanted everybody to understand the difference between the rapid test and the PCR test. The PCR test is the gold standard test that we've been doing at our locations. And so that one is the one that picks up on any genetic material that you may have from COVID-19. Now, this test is very, very sensitive and does a very good job of picking up COVID. Now, it can take a few days to come back, and it can linger when you're not infectious. And so those are important things to remember. And you may need that test for different things, just if you need to know for sure if you're positive or not, or you have to turn in a result to somebody. The rapid test, now that does not mean the rapid test is not useful. Now, the rapid test, like its name, is rapid, anywhere from 15 to 30 minutes, and you'll get a result. There are some issues with the rapid test. They have a lower sensitivity, meaning that if you have the virus actively, there's a chance that it may not pick up on that. But it still has good sensitivity that it will pick up on most of the cases if you are infectious. And so this one we use if you are thought to be infectious with COVID-19. So it's important, though, that one test is often not enough. You may need to do 2 tests at least, and at least 24 hours apart to make sure that you are truly negative. If you're a positive, you're most likely a positive unless you've had no contact with anybody that could have COVID, then you may be negative. So that this test may require having a confirmatory test. And so I want you to keep that in mind. If you have symptoms that look like COVID and you've been around people or have been exposed to somebody with COVID and that test comes back negative, I wouldn't automatically take that as a negative. I would either go ahead and repeat it in 24 hours or get the gold standard PCR, because you don't want to miss having it. And then with the infectiousness of this one, give it to many people. I just wanted to remind folks that right now, we anticipate that this will go down over the next few weeks, and hopefully the hospitals will peak very soon as well. But it's very important. Getting the vaccine and the booster are extremely important. And then also, please wear your mask, a good fitting mask, and try to avoid big crowds right now, and wash your hands and keep your distance. We really just need to do these during the surges to keep this all at bay, so that we can all help to bring the numbers down and keep the hospitals available as we need them. So thank you very much.
Thank you, Dr. Maymark. Now I'll punt to Dr. Brandstetter, our resilient physician who's been in the forefront of planning with our Wellstar team and many of you in the community. Dr. Brandstetter, good morning to you.
Good morning, Dr. Chapman. Thank you for that introduction. I'm proud to be part of a great team, including this team with Cobb County that we've been working for now going on 3 years to help get information out to the community about how we can best get through this together as we are learning to live with COVID, because COVID is here to stay. We're going to see more infections in our communities. We're all at risk to get it. Our goal is that overarchingly that we make this a nuisance and not a deadly disease. So please remember, the information we're imparting on you is doing our best to keep you as safe as possible, as healthy as possible, so we can all continue about our lives without any significant impacts on the quality of our lives, and certainly want to avoid death. And that, again, is the biggest thing that I want to remind people that vaccination does. It reduces the risk of having severe illness, a complication, and death from COVID-19. So you've heard it before. I'll say it again. It's still our best tool. But using all these tools that you hear day in and day out to prevent infections, to prevent transmission, and to keep you healthy as possible are all there to use in combination for the best risk reduction of COVID-19, not only individuals, but within families and within our communities, schools, civic organizations, churches, religious organizations, etc. I want to give you a little brief update of what's happening inside the walls of our healthcare institutions. We're seeing a significant rise in the number of patients coming in symptomatic from COVID-19, and all of our entry points. That includes primary care, urgent cares, ERs, and what that's impacting is it really is seeing significant wait times in a lot of those locations, difficulty getting in to see your primary care doctors, getting an urgent care appointment, all delayed. Want to remind people that virtual care is also an option for a lot of illnesses, and you can start by accessing healthcare that way. So don't forget about that important access point for health care for our community. The other thing that I want to give you examples of is this was such a quick rise in our infections within the community that we were seeing almost a 200% increase in the hospitalizations in the metro area. That is phenomenal. We didn't even see that in our earlier surges. The good news, if there is any good news about this particular surge, is that we are seeing far less severe illnesses, and particularly in those who are vaccinated. So with our people needing to be in the ICU and on ventilators are less during this surge. That does not mean that we should relax any of these measures because the humbling thing about COVID-19 is we cannot predict who is going to have that complication. So getting vaccinated, watching and your distance, wearing your mask, washing your hands, all used in combination helps us help you get through this better. So the other things that we're seeing is you may be hearing about diversion. I want to just give you a blanket information about diversion. You probably heard it before. It's not an attempt to close a hospital. Our hospitals, emergency rooms, et cetera, never close. We're here to care for you, continue want to provide excellent care for you, even during our times of these great increase in volumes of patients. What diversion does is it allows emergency medical personnel to respond and get you to the most appropriate care at the most rapid spot that can occur, so you can get it in a timely manner. That's the tool that we use to do that. We don't like to utilize it. We want to make sure people get those in their own backyard and close to home. But the important thing there is that it's using that to get you to the right care at the right time. You've heard about vaccinations. The good news about vaccinations over and over again is the safety. So looking at safety for boosting, looking at safety for even a fourth dose in the trials that are being done for is a fourth dose necessary. The safety data is there. The data published from the 12 to 17-year-olds, the biggest thing we worry about side effects was the myocarditis. You probably heard about that. Did not see any increased safety signals in millions of doses given in places like Israel and UK, who were giving those doses even before the United States. So safety data is there. I think that is reassuring information for everyone. So you've heard it before. Please, if you're not having symptoms, getting a routine test, please access those in other locations other than urgent care and emergency department. You'll hear about those options from Ms. Crossman a little bit later. We are seeing a lot of our testing results start to climb down, but that does not mean that the number of infections are nil in our community. We're still seeing a very high level of transmission in our communities, even though we're starting to somewhat come down from our peak. Again, the humbling thing about COVID-19, hard to predict if this is going to continue in the downward trend. So these precautions are still necessary not to relax. And thank you again, communities, over and over again. You've stepped up. You've done the right thing when these surges have come and help us get to the peak and start to come back down. So once again, thank you so much for your continued attention to all these measures. And thank you for your flexibility and your patience as we handle all these high volumes. We're here for you. Want to make sure that you can continue to take care, see your primary care doctor, use all the avenues to get to your care that's possible, such as virtual care. Don't forget about that. I do want to take a few moments to talk about treatment. So with the Omicron, there was a lot of concern about the monoclonal antibodies that we were utilizing may not be as effective. There are 3 current approved monoclonal antibodies for use in the United States. There is one called sotrovimab. It's made by GSK. It is effective against both Delta and Omicron, and that's what we have to utilize, and that's what we're utilizing right now within Wellstar. And we want to thank our government officials for helping us get more and more supplies to that. The state has been very gracious in getting us in that on a regular basis and increasing our supplies so we can offer it to more and more people. We are tiering that based on the greatest risk of progressing to severe disease to prevent hospitalization and death in that population. You probably also heard about the oral medications now available, both from Pfizer and from Merck, and how effective they are at helping with combat COVID-19. The biggest information I want to impart, it is not a panacea. Panacea is a universal treatment for everyone. There are significant drug interactions. There's a time frame in which it's most effective. So certainly if you're having symptoms of COVID, get tested as the first step, and then talk to your healthcare provider about if this is the most appropriate therapy for you. And then certainly the final thing is they're not in robust supplies yet. Our state is working with federal officials about getting us more and more supplies, but they're throughout our state. So pay attention. There may need to be limitations, and you may hear about difficulty accessing those. There are great work going on behind the scenes to make sure that we have all those things addressed. And I want to think about all of our public health officials for weighing in and our state officials for helping us with that. The important thing about masking, the masking is the big thing in the news. Is CDC going to change the recommendations? The keys that I want people to remember, it's multiple layers, so not a single layer cloth mask, multiple layers that can be multiple masks, like 2 masks at once, or just a multi-layer cloth in the same fabric and making 1 mask. Using those higher grade fabrics such as the KN95s, the KF94s, or N95s, if you have those available, those kind of fabrics also help. If you can see through it, it's not effective enough. So that's the type of materials to look at. But the other important thing is it's got to be a snug fit. You can have a N95 that is very large and not really creating a tight seal on your face. It is no more effective than wearing that single layer cloth mask, because it's really got to be a snug fit and the multiple layers. So those 2 are the important factors when you're thinking about what's the right mask for me to wear. And then finally, if you have a fabric mask such as a N95 or a KN95, make sure that you replace that if it gets soiled or worn. The other thing you have to look at is the fit may be compromised if the elastic bands and stuff used to secure those get too stressed out. So those are things for when you need to replace those. There's one final comment that I will make is how communities can help. Right now, we are facing a shortage in our communities of blood products. Blood products are life-saving for traumas, for a lot of people going through chemotherapies or having disorders that require transfusions of blood products. We are having a national shortage, and certainly in our own backyard, we're having that shortage as well. If you're able to donate, one thing that the community can do is provide blood donations. So sign up to donate blood. It is safe to donate blood, and there's barriers and protections in place to mitigate the spread of COVID-19 while you're donating. So please sign up to do that as one thing that we're asking communities to do at this time. With that, I'll turn it over to Dr. Chapman. She may be on mute or unable to get off mute. I will turn it over to Stephen Vault, our community liaison, and for a further update.
Thanks, Dr. Brandstetter. Can everyone hear me okay? Awesome.
Yes.
Once again, Wellstar is always very grateful for the opportunity to come and share how we as a system are responding from a community standpoint. We remain grateful and want to continue to work alongside all of our county officials to address the needs of the community, and just thank everyone who has supported us and all the communities over the past 22 months. We've been dedicated to providing COVID community updates and various resources, and most of those can be found on our website, which is wellstar.org/community/COVID-19. There you'll find recordings of our latest community update, our community briefing, which was done in December, as well as many other resources and information, much of what we talk about here on these types of calls. But please check that out when you get a chance. There's a ton of information you can share with family, friends, and the broader community. Again, I'd be remiss if I don't thank our DPH partners for our continued partnership on testing sites. We are doing those testing in connection with them. Right now, currently, we have testing available at our East Cobb Health Park, located at 3747 Roswell Road in Marietta, and it's running very well. On average, it was 150 to 170 tests were being performed daily, which is down from approximately 350 tests daily earlier this month. But testing remains strong. As Dr. Memark mentioned, testing is available 7 days a week. While pre-registration is encouraged, it is not required. So again, just a resource for the community if needed. John Keevan mentioned the support of the National Guard, and we are extremely thankful for them and have to thank them for how they're continuing to help us serve our patients and communities during this surge. Those members have been approved to support our frontline caregivers across the system, including at Wellstar Kennestone Hospital. Also, just a huge thank you to our congregational health team at Wellstar, who has held about 70 pop-up vaccination clinics since April 2021, the most recent being held in coordination with Cobb Douglas Public Health at Pleasant Grove Baptist Church and was a booster clinic. There are various support services that are being offered in the spring as we think about COVID, because we know that this surge has really impacted complete way of life. And so it just shines a spotlight on all the other things that happen when COVID is present, like food insecurity, homelessness, housing. And so our community health team is doing a lion's share of work of really making sure they're addressing those needs through a number of different ways. And so we'll continue to push that information out and have that available on wellstar.org as well. In closing, just again, thank you for calls like this. Thank you for the community town hall that just allow us to continue to push relevant and pertinent information out to the community. Wellstar stands at the ready to, as a community partner, to help us get through this surge. With that, I'll turn it back over to Dr. Chapman.
Thank you, Stephen. Must having some technical difficulties. I'm now going to turn it over to Lisa Crossley.
Thank you so much. So I wanted to remind everyone that since the pandemic started, we've had professionals from the county, from Wellstar, from public health, and many other areas that have been meeting sometimes weekly to review the needs of the community and really take targeted efforts to meet those needs. Early in the pandemic, it was working to find ways to reach our seniors as quickly and efficiently as possible, to launch home vaccination and home testing opportunities with our some of our agencies throughout the community. And so this group has worked very hard to help make sure that all of our residents across Cobb County have had the access to testing, to vaccination, and to care that they've needed. Most recently, we've had the demand again for testing. I know that folks were very frustrated about having long waits at some of our public and private testing opportunities across the county early this month. Staff rallied across the county to be able to ramp up and add staff and add locations. And so now I believe that you've got access to public locations at the East Cobb Health Park with Wellstar that Stephen mentioned. That's a partnership with public health and our LTS testing folks. We also have a location at the Riverside Epicenter, and we appreciate their long-term partnership to host us for testing and vaccination. We currently are offering 2 days a week at that location, but beginning on Monday, we'll expand to Monday through Friday, 8 to 3. And so that will begin next week. We recently opened up our Jim Miller site again for testing, and that's open 7 days a week, Monday through Friday, 8 to 6, and Saturdays, 8 to 3. Sincere thank you to the Cobb County staff and our Viral Solutions partners at that location that really ramped up very quickly to be able to offer that mass site. And then we recently also opened our KSU BrandSmart testing location again. I can't say enough about our KSU partnership, and they've hosted us for vaccination and testing throughout the pandemic. We opened that back up on the 4th, and it's also open 7 days a week, Monday through Friday, 8 to 4, and Saturdays and Sundays, noon to 4. We have a number of other initiatives that we've been working with the county and with Wellstar and with the state DPH, and also helping get some funding through the CDC and our CDC Foundation. Most recently, we've been able to launch the resource coordinators again. This is a partnership with Sur Familia and Center for Family Resources to be able to offer residents in the community who have been dramatically impacted by COVID and need other resources like housing and utilities and other services that we've offered to fund some additional resource coordinators so that access is improved. And then most recently, we have a partnership with DPH and the CDC Foundation to host our community health workers. And this is going to be a partnership with Morehouse School of Medicine. And we will be deploying numerous community health workers across the county to be able to provide residents with the linkages to needed services in a really efficient and quick way and boots on the ground way. So shout out to Morehouse. They've been doing community health workers for decades. And I really appreciate Jasmine McLeod is on this call, and she's going to be our point of contact with public health and Morehouse School of Medicine to get that launched. And we hope to have folks out in the community in February. And then I also want to thank our Six Flags Over Georgia. You know that all throughout this pandemic with vaccination efforts, we've had public and private agencies step up very quickly to us to help provide some vaccine incentives. Most recently, Six Flags Over Georgia donated over 1,000 day passes to be able to give to youth who were getting vaccinated. So thank you so much for that donation, Six Flags. It really made a difference and gives our youth something to look forward to when you all open up in March. And then I wanted to mention that we've recently partnered with Marietta City School System to offer our contact tracers and the Test to Stay project. They're working very hard to make sure that their students are safe and remain in school. And so we remain on the ready to help all of our schools, public and private, with their needs. I just want to wrap up by reiterating what folks have said earlier, that we feel like vaccination for our youth and our adults is the best tool that we have to get in front of this and to prevent serious illness and death. We continue to work with Wellstar and the county to offer multiple locations around the community. We offer them at all of our public health centers. There, we have outreach teams that will do satellite locations that will go to particular businesses or schools. We also have a great partnership with Pools Pharmacy to offer homebound vaccinations for those individuals who are not able to get out of their home to some of our locations. A reminder to our residents that Lyft is also partnered with us to offer free transportation to any of our vaccination sites. You just have to call the 211 number to get access to that. That project will go through the end of June. So again, a reminder, please get vaccinated. If you've been exposed or are showing symptoms, please make sure to go get tested. It should be easily accessible now. And then please make sure to follow the 3 W's, particularly through this surge. And I'll stop there and turn it back.
Thank you so much, Lisa. I just want to remind one more time, I know that John Keevan, when he updated the group, talked about our, care in the right place, the right time. You may have heard, again, our emergency departments, which is typically the largest front door to our hospitals, because of the increased number of patients, and with our COVID patients being mixed in that, by way of that when they are admitted to the inpatient side, we COVID test them to make sure that, again, that we're placing them in the correct space in our facilities. This does add some additional processes. And so you may have heard, and I believe that we still will continue to experience, as long as we're in the surge, some extended wait times in our ED. So one more ask that we have from a Wellstar perspective is helping us with providing some level of grace in terms of that the teams are really trying to do the best they can to move patients to their final destination within the inpatient and or discharge them from our emergency departments. Cobb Hospital and Keystone, we try not to go on what you have heard, diversion, at the same time, so that we can, again, continue to provide services to our community. But we're here and we are available if there are concerns or questions or things that you're hearing that you feel like that we need to be aware of. Please don't hesitate to reach out to any of us so that we can work together to problem solve together. And with that, on behalf of the Wellstar team, Candace Saunders, our CEO, I will punt back to you, Chairwoman Cupid.
Thank you, Dr. Chapman. Can you hear me okay?
We can.
Okay, great. I'll open it up for anyone here at this meeting to see if you have any questions. Does anyone have any questions? Dr. Chapman, you referred to, again, Dr. Branstetter talked about diversion. Can you clarify what that is again?
Sure, I will. Diversion simply means that there are periods of time by which we have high numbers of patients waiting either in our emergency department and or in our back-end spaces. For an example, we have no more bed spaces in our critical care unit. We use diversion as a way to minimize or put on hold the number of patients that are being transferred in addition to the existing ones we have, which means that the ambulance services would need to, when they have a patient, to transfer that patient to a different hospital. And in Keystone and Cobb's example, we try to never go on diversion at the same time. So the diversion is really a hold on the intake of patients within our facility. And oftentimes it's driven by, again, not having space to put the patient. If the patient is transferred, they would have to hold over in the ED, in the already existing full ED. So we're trying to find spaces that thus are available that can take care of the patient in some level of immediate care that they need. So there are different levels of diversion. Oftentimes people think that diversion means that we have, closed our doors. It means simply that it could be critical care diversion, it could be ED diversion, and all of those are different spaces in our hospitals that we care for patient populations.
Okay, thank you for clarifying that. Certainly, yeah, it's reasonably understood that with the number of cases we have, that there are going to be longer wait times, not just for testing, but for people seeking care. We can do our best on our end to just encourage people to be patient with our healthcare system.
You're breaking up. You're breaking up.
Okay. Okay. I will turn things over to you.
Say that again.
I will turn things over to you. I do not have a good signal.
Oh, okay. Other questions for the group? If there are no other questions, then that is our update for this week. And again, we appreciate everyone and the continued collaboration. We never want to be in this space ever again, but I think that we have all shown that together that we can get through this. And so hoping everyone have a safe weekend. I know that in our space, we are talking about potentially our inclement weather that's going to potentially happen this weekend. So I'm sure that everyone is trying to ready their business units and their own personal preparation for any weather. So everyone stay safe, and hopefully you have a great weekend, and we'll see you back here next week, and take care.
Thank you. You too, everyone. Take care.